In order to really let your femurs hinge in the joint, there actually needs to be some widening happening at the pelvis as well. So if the pelvis is being wedged together because of muscle tightnesses, ligaments that are tight, whether it's from injury or emotional stress, any trauma to the organs inside the pelvis there, all the muscles of the pelvic floor and the fascia will be really tight and not allow for a lot of movement there. That means if the pelvis doesn't move, the movement is less likely to happen in the hips since it's part of the articulation of the hip joint, and it means movement is going to be more likely to happen in the lumbar spine. So, and that is really when the destructive forces happen in the lumbar spine, causing injuries. One of the things that you can do is first just orient yourself to the pelvis and what it's all about, how the anatomy is. The better you can imagine the anatomy in your brain, in your eye as the athlete or clinician, the more easier it is going to be to open things up. So first we're just going to talk about that. So I have my model here. Here's the femurs, cutoff, and the pelvis. So when you're sitting on your pelvis, a lot of people don't realize, they think maybe you're sitting on your tailbone, but you're actually sitting on your sits bones or ischial tuberosities. So many times though when people sit, they tend to sort of roll back on the back side of their ischial tuberosities, which does put a lot of pressure on the tailbone here. As that happens, it takes the whole sacrum into a extension like that, putting the lumbar spine in relatively more flexion. Most of the time, people don't even realize this is happening. So as this is happening, you also see that you have diminished hip flexion. So if I can teach people how to sit a little bit more on the center of their sits bones, send their tailbone back, you see how it automatically restores the curve in their lumbar spine and creates more hip flexion. So if you're trying to improve someone's hip flexion, hip hinging in an RDL motion or a squat, it's really important to also pay attention to how they're sitting or what their sitting habits are, because most of the time they're sitting during the day, not working on their hip hinging. But at the same time, that's the whole point, is every moment they're sitting, they're actually have an opportunity to either improve their hip hinging function or make it more poor. In order to find where you are on your sits bones in sitting, it helps to do a little soft tissue or stretching of the area, and that's what we're going to work on next. So when we start to think about what soft tissue we can do around the pelvis, one, it's important to understand what's going on. So if we look at the bottom of our pelvis, so this is our pelvic floor, as if I were looking up someone's spine, you notice that you have a big space here, right? The majority of your pelvic outlet, which would contain your anus, your vagina, your urethra, right? Or your genitals, basically, whether you're male or female. And then also you have an outlet right in front of the pelvis here, your obturator foramen. So your obturator foramen is right inside your groin here on either side of your pubic bone. This is your pubic bone. Above your pubic bone is where a lot of attachments happen from the abdominal fascia as well as from the organs. So depending on whether you're male or female will depend on what organs attach here, but everybody has some ligaments right here that attach the bladder to the front of the pelvis, as well as your abdominal muscles, your groin muscles, all of them sort of wrap around here. So these are the areas we're going to focus on doing soft tissue to. Most of the time when people think about working on their deep hip rotators with trigger point balls or any sort of soft tissue, they're thinking of doing it more up in the glute muscles or in the back of the pelvis, right about here, so where your pocket would be. So I think people have a fairly good idea of how to do this already, but where I want you to start thinking about is things that are lower than that. And that's really going to help to change the amount of space that's available in the pelvis, which has a lot to do with any incontinence problems or gastrointestinal disorders, your breathing function. It's all a game of pressures. So pressure of the pelvis, pressure of the abdomen, pressure of the thorax, pressure of the head. These all have to equal out for our normal bodily functions to occur. And when the pressures are off, bodily functions are off, and then you get this nasty feedback cycle of not feeling great, so the muscles tighten up, increased pressures or decreased pressures, and just this nasty cycle. So beginning to get some soft tissue work and learning how to move these bones is key. So with the soft tissue work, it's really imperative to have a soft ball. You cannot do this type of soft tissue in these sensitive areas with a hard ball. So no baseballs, no racket balls, no lacrosse balls, no tennis balls, no golf balls. They need to be soft. So I would rather people err on the side of too soft than too hard, because even with the soft balls, having stimulation down in this fascial area is going to increase your sensory information and improve blood flow and just general vascular supply to the area, which helps to improve general function of everything there, the ligaments, the organs, the muscles, etc. So the softer the ball, the better. These balls specifically are Franklin method balls. So this is a Franklin smooth ball, this is a Franklin texture ball. You notice they're different sizes. So as you're beginning, the bigger size is better than the smaller size. So you're gonna take the Franklin ball and you're going to start on the sits bone. So right on the sits bone, and I usually have people sort of roll around the sits bone first just to explore how big of an area it actually is. Then from there, I have people roll back up the side of the pelvis. Okay, so from the back, it's gonna look like this. Ball is on the bottom of the sits bone, and then we roll up the side, and we just can do a fan on the glute, just the area that you're already familiar with. Fan that open. And then also focus on the spot in between the sits bones and the tailbone. So you're going to come a little bit posterior and then midline towards the tailbone. This is gonna start to be really tender, okay? So just be careful, take your time, and breathe. From there, we're going to then explore right in front of the tailbone towards the perineum body, and a little bit anterior. So exploring the anterior and posterior pelvic floors. We'll work on the other side, same spots. Then we'll flip over and we'll start to explore the superior surface of the pubic bone and into the obturator foramen here. These are both really great spots that don't get a whole lot of attention on either manual therapy or self trigger point therapy, and make a huge change in how comfortable you are seated on your pelvis, and then improving the mobility of your hip joint in order to hip hinge more comfortably. So first off, it's always good to decide where you're at in terms of where you are in your body. You can check with a simple long sit position or cross-leg position. Notice how comfortable you are sitting on your pelvis. Notice how your pelvis feels, how wide it feels, where you feel like your weight is, how free your tailbone feels. Then you're going to pick the soft, larger ball, and you're going to start with the work. So you're going to lean to one side, place the ball under your sits bone, and then lean back on it. Also lean back on your hands, uncross your legs, support yourself with your arms, and just roll around the area of the sits bone first. The front, the side, both sides, outside and inside. Then you can work your way up the length of your entire pelvic half to your low back and then back down. So you'll just go out in a fan shape all the way to the side. Once you're done with that, take some time to go all the way to the side. So you're sort of turning on your side. You're going to switch to take the ball from the sits bone to the tailbone. So this gets a little bit more uncomfortable, especially if you're not used to it. But you'll just roll back and forth there and go slow. Pay attention to what you're feeling. If you feel a spot that's uncomfortable, don't push into it. Just sort of go away from it a little bit. In a softer spot, take a couple breaths and notice where your body wants to direct the ball to go. Your body will tell you where it feels like you can sort of enter the tissues and enter the fascia. So continue just to work that area between the sits bones and the tailbone. So it'd be like the sacrospinous ligament, the coccygeal ligaments. As you get more comfortable, you can start to sit more upright on the ball. You might not be able to do this first session, and that's okay. But as you get more comfortable, you can put a little bit more pressure on there. But again, I'm paying attention to where the ball wants to go. I'm not forcing it somewhere it doesn't want to go. So you can just kind of sit here and breathe. You can move your leg side to side. Again, you're just going to what your body feels like it wants. So if it feels like your body wants to let your leg fall out to the side, go for it. If you want to scoot the ball forward, go for it. We're just really working on all those tissues in the inferior part of your spine. So your pelvic floor, pelvic fascia. Then you can come a little bit more forward. So now we're sort of lateral to the perineal body. Right up against the ramus of the ischium. So right up against here, inside. So you're just, again, letting the ball direct you where to go. Once you've had enough, you can come on off that side and notice how you feel. Recheck whatever positions you're in. Cross leg, long sit, what do you feel? So I feel a little bit wider, like almost the entire left side of my body is more open now. Less pressure in my knee and a cross-legged position. Then to get the front of the obturator, you want to put the ball right below your gracilis muscle. So follow the line of the gracilis. Right posterior of the gracilis, you have a little space between gracilis and the adductor mangus that lets you in the obturator foramen. So it's going to be tender. You're going really medial. And you're just going to find a spot that feels like, okay, I could hang out here for a second. Keep breathing. You might want to bend your knees so you can rotate over your hips a little bit and see what your body likes. So my body is telling me, I think you can go a little bit deeper and further if you rotate to the right. So I listen to it and I just wait, see what it wants, and then it just takes me back around. But as I'm coming back around, I feel the ball being allowed up a little bit better into my obturator foramen. So I'm right here, so between my pubic bone and my hip joint, right in this obturator foramen spot. So that's a really great area to work. Your obturator externus muscle, the membrane between the two, the obturator internus real deep, and then it gets into your deeper pelvic floor muscles. And then finally, if it lets you in, sort of in that space, you're actually accessing the endopelvic fascia, which is the fascia that surrounds all the organs and has a lot of vascular structures in it. So you might even feel as you get in there a sense of a little bit more warmness, sponginess. Taking a deep breath. Again, not forcing it anywhere. So it's just rolling back and forth. And I feel like, okay, it's let me in. I don't feel uncomfortable. I feel things relaxing. So then I go ahead and do the other side. And always rechecking. So I've really freed up that left side. And now I would like the right side to feel that way too, so I'll go over all the same structures on that side. Next, we're going to work on the front of the pelvis. So working on the bottom part of where the abdominal fascia inserts, the ligaments that hold the bladder, part of the ligaments that hold the bladder in place, even accesses a little bit of the broad ligament of the uterus along here, pectineus, the ligaments that hold the prostate. So this is a really important area to free up and help to start changing the pressures into the pelvic floor. So this is going to help with breathing, core stability, incontinence, low back pain, really powerful stuff to do. So we're going to take the ball sort of on the superior lip of the pubic bone and right inside. Again, the ball should be really soft, and the bigger the ball, the little bit more comfortable. It's probably like a bell curve. Too big is not quite right, too small is too uncomfortable. So finding the right size and softness of the ball is important. You never want to create pain when you're doing this, especially when we're working on somewhere that has the organs so exposed. So the organs sort of stack up right here, the bladder, the prostate, uterus, and the rectum, and then the small intestines, and we don't want to press on that stuff. They're very highly innervated and can be quite painful, and we don't want pain to be elicited, because then pain creates more trauma, more protective mechanisms, and actually tighten things up and not loosens them. So having a soft ball and listening to your body and letting your body guide you in is so important. You're going to take that ball. I always like to start in kneeling so that you can just feel where your pubic bone is, so that hard part below your belly button and above your genitals. You're going to place the ball right on that bone, and then slowly lower yourself down. Lowering yourself down, just take some breaths, and then you can feel the ball roll to the superior part of that bone. And notice again where the ball wants to let you in. Take some breaths, and not forcing it. So go to the area of ease. So go where it's actually less uncomfortable. Take a couple breaths and see how your body then wants to move the ball in towards the spot that was uncomfortable. Your body will go where it needs to release as long as it's on its terms, not forcing it. Once you feel in a comfortable spot, you can add your leg motion in. So actually turning your entire leg externally rotated so that the inner thighs are on the ground. You're actually bringing in the entire fascial line that connects into the bladder. So in Chinese medicine, this would be your bladder meridian. Goes up the medial side of your leg, and you really feel that when you externally rotate, it really accesses a little bit deeper into the superior part of the pubic bone, which helps to expose those ligaments a little bit more. If this is too uncomfortable, go back to a neutral or internally rotated position in your leg and work your way into that external rotation. You can take your pelvis side to side, just being really comfortable here. If you'd like to start going along the pubic bone, the pubic ramus, towards the hip joint, and start accessing the ligaments along that pectineal line, go ahead and do so. Again, just with the same method of not creating pain, finding the area of ease and letting your body direct the treatment, direct the direction you're going and the depth you're going. Use the intelligence of your body to make the changes. Don't force things. So you can work your way along the pubic ramus towards the AIIS of your hip, back to the center right above the pubic bone, and then to the other side. Breathing, moving your legs, moving your pelvis, whatever is needed. Then come up off of it and recheck your seated positions. Either the cross-leg position or the long sit, whatever feels comfortable to you. Once I do all of that soft tissue routine, now all the bones are freed up, so we can start to do some more movement experiences or exercises to learn how it feels with your pelvis rotating, your sacrum flexing and extending, and your tailbone moving through flexion, extension, side bend, rotation. Once we can feel all that, then hip hinging is so much easier to learn.